Alright, so this is my audience. 1, 2, 3, 4, 5, 6. Outdoing myself over here. Alright, so did you know that there are about 1.2 million abortions that take place every year in the United States of America? In 1973, the United States Supreme Court made it a constitutional right for pregnant women to have an abortion. Even with the newer, more effective, and more widely used birth control methods, more than half of the 6 million pregnancies occurring each year in the United States are considered unplanned by the women who are pregnant. Illegal abortions are unsafe and account for 13% of all deaths of women because of serious complications. It is estimated that 20 to 30 million legal abortions happen worldwide and another 10 to 20 million illegal abortions occur every year. Abortion is a lot longer process than most people think. It first goes through the Constitution with the Roe versus Wade case. Then you need to choose the type of abortion that you want to have, and then you have to deal with the emotional and health risks that an abortion brings. The Roe versus Wade decision is a very controversial issue in America. Political bans for late-term abortions became another big issue in politics. Late-term abortions are categorized as those performed in the third trimester of pregnancy. By 1998, 28 states had passed bans in this procedure referred to as a partial birth abortion. Most young women have parents or family involvement in their decisions to have an abortion, but that is not always true. Young women who do not seek parental involvement may be at risk physically or emotionally. Therefore, the government has enforced that all minors seek parental consents or their parents be notified in advance of a minor child having an abortion. The laws that have enabled this to occur legally are backed by the U.S. Supreme Court. As of 2007, 35 states require some sort of parental involvement in a minor's decision to have an abortion. 22 states require parental consent. Only 11 states require parental notifications only. And 2 states require both parental consent and parental notification. While few state public funding sources cover abortions except in cases of jeopardy to maternal life, many private healthcare plans do cover abortion counseling and procedures. Before 1974, abortions were a lot less common, and therefore there are a couple of reasons for that. Number one, immoral. It was immoral, immoral sex was not as prevalent as it is now. Most women waited until they were married before they had sexual intercourse. And the other reason that abortions did not happen as often is because the women were forced to bear their children. It was not medically done very often, partially due to the technology. Although secret abortions did take place, they just did not happen as often. The future of abortions are going to increase as physicians get paid well to perform them, and it's easier than just taking the pill all the time. As time goes by, more technological advances are taking place with better forms and more effective birth control. Abortions have become the most popular form of birth control and will continue to do so as time progresses. There are a couple of popular legal procedures to have an abortion, and they are surgical abortions and medical abortions, which are the most popular. The process of surgical abortions is when a healthcare provider will give you pain medications. They'll inspect the uterus and will insert a suction device to suck up the contents within the uterus. The process of a medical abortion involves bleeding. So they'll give you like a pill which will make you bleed. It's often like a heavy menstrual period, which must be differentiated from a hemorrhage, which would be like a severe bleeding disorder. Regardless of the amount of tissue passed, the woman must see a doctor for evaluation to make sure the process is complete. After an abortion, the healthcare provider will watch the mother for 30 minutes to make sure that she is not bleeding profusely. If she does start to have abnormal symptoms like severe pain, a fever of 101 or 100.4 and above, or she's going through medical treatments, the woman may also go through psychological effects like grief or depression from the decision of having an abortion. Mothers also go through sadness and guilt along with regret on their decision of aborting their baby. There's a lot more involved in the abortion process than one would think. You not just go to a clinic and get prescribed drugs or a drug and bam, the fetus just magically disappears. It is a long process that can take a huge toll on the mother. Anyone that is thinking about having an abortion has to weigh their options and make the best decision for themselves. Abortion has a major controversial subject in America. It went through the court system with the Roe versus Wade decision. Many of different types of abortions have been scientifically developed, and the mother can face a lot of emotions after having an abortion. All these things should be considered when thinking about whether to have an abortion or not. So, that's my speech. There's my audience again. And that's it.